let's begin here. Our government says that the South Africans due to be evacuated from the coronavirus epicenter in Wuhan, China, are healthy.
Well, speaking yesterday, the Interministerial Committee responsible for the operation says every measure is in place to ensure COVID-19 is not imported to our shores.
Now, as many as 151 South Africans are scheduled to be repatriated next week. Now, that's before being confined to a secure location under quarantine. Here's eNCA's Barry Bateman with the story now.
Images of the mass shutdown in China have gripped the world. Doctors in masks and full-body medical suits have raised concerns about COVID-19. But government has appealed for calm by setting out in precise detail how it intends to bring its citizens home.
The people that we are bringing in are South Africans who are healthy and as far as we are concerned, they are not infected. We only want to take a precaution to allow the tests to be done so that in the period during which the virus should be incubating, we should then confirm that they didn't get infected and therefore they can be released.
The people to be repatriated will be checked before getting on the plane.
And all nationals that do not meet the medical screening requirements during the pre-screening phase will be referred to the Chinese health system.
Once back on home soil, they will be confined to a secured area with no physical contact with the outside world for at least 21 days.
No one will be allowed to enter the zone. Not the media, not the families, not the officials who want to come and inspect from whatever. Only those who are assigned are going to be allowed to be in there.
The government has warned that any person breaking the quarantine protocols will face legal action. The minister says this process is to ensure the safety of all South Africans. But he adds that the country must be prepared for what is widely believed to be an eventuality. Barry Bateman, Johannesburg.
Meanwhile, Africa is reporting its sixth case of the coronavirus. Algeria has 2 more cases and Egypt has detected its second case. Meanwhile, the U.S. recorded a second death in the state of Washington. The epidemic has claimed more than 3,000 lives globally.
Of course, South Africa has no reported cases of the coronavirus within our borders, but government has repeatedly said it's ready to tackle any outbreak should it hit our shores. The question is, can our already debilitated public health system handle such an outbreak? As many as 151 South Africans living in Wuhan, China are scheduled to return home soon, we understand sometime next week. Joining me now, Dr. Angelique Coetzee from the South African Medical Association, and also Prof. Andreas Engelbrecht, Head of Emergency Services at Steve Biko Academic Hospital. Thank you both for coming in this early Monday morning. I'd like to start with you, Doctor. How ready are we? It seems that our government is taking this seriously, judging by the tone coming from that interministerial meeting yesterday. Are we really ready?
No. We are as ready as we can be, but we're not, and that's not much. We are not ready. I think the broader public out there needs education. Our doctors need education on what to do. I call it the ABC. There is no ABC out there yet. So for me, we're not ready. For SAMA, we're not ready.
So what does that mean? I mean, if you look at the diseases in South Africa, we have high TB, we have vulnerable people, and many people with HIV, AIDS, compromised immune systems. If this virus, which presents with more serious symptoms than your normal flu, hits our country and starts a community spread, in other words, we just don't know where it's popping up, surely we're in sort of fairly disastrous territory.
Yeah, that's why we say we are not ready. We need to get education out there to the broader public, again, to doctors, to clinics, and what to do. What do you do if you think you have a flu-like virus? What's the steps to be taken? How can I protect myself? How can I, as the public, make sure that I do not spread it to anyone else? So It's not, I think the misnomer here is that everyone thinks government must be ready. It is how ready is the public of South Africa.
That's a very good point. Prof. Engelbrecht, I'll bring you in at this stage. You work at Steve Biko Hospital in Pretoria. Should we all just be manically washing our hands and wearing face masks in preparation?
Look, hand washing is always a good principle. So I think I wouldn't say no to that. I think we don't need to do it as a measure of panic, but whenever we, as health professionals, work with patients, it's very important that we apply hand-washing principles. And the public should also be aware that, basic steps of personal hygiene, such as hand-washing, is a good principle. In terms of masks, I wouldn't say that, the public must panic and run out and buy masks. That actually creates problems by itself. When 1 million or more people start buying masks, it actually depletes the stores of masks. So that
Which are needed in hospitals.
And it's needed in hospitals.
How ready
no need to panic.
are the doctors and nurses at Steve Biko, for example?
Yeah. At Steve Biko, our staff is well prepared. They are, we've created a SOP for them, which includes the case definition of this condition. And they are ready to deal with cases of patients that might present with this condition.
If you listen to what President Trump says, of course, he's no health expert, but he's saying it's a bit of a storm in a teacup. It is certainly nowhere near the fatality rate of Ebola virus, which was sort of 9 out of 10 people who got that hemorrhagic virus died. This is it's just over 2%, I think, which of course is still 20 times higher than your seasonal flu. How concerned are you as a health professional working in the public sector? How worrying and how damaging could it be? Bearing in mind that we've got much bigger problems, HIV, pneumonia in our country.
Look, I think there's reason for concern. I don't think it's something we can just laugh off. The fact is that these viruses are known to cause, especially patients with depressed level of immunity, elderly patients, pregnant patients, they are known to cause severe pneumonia. And that is an area of concern for us. I think if the virus was to be allowed to spread freely, and we were going to have to deal with many patients with more severe disease, that would put a very heavy burden on our health facilities. So there's definitely a reason for concern, and I think it's important for us to try to contain and limit the spread of this disease.
Dr. Coetzee, one of the concerns is that in the next week or so, we're going to have 151 odd South Africans returning to our country. We're told they're completely healthy, but there are concerns that they might bring the disease back with them. How good are our quarantine facilities? How careful are we in a situation like that?
Again, we need to understand that if you bring in people with or a huge number or a large number of people into the country, knowingly that they're coming from a place where there is infection, we are not geared for that. But government did try their best in getting a facility that is in the urban, in a rural area, where there is a lot of open air and space, where the contamination, because remember, this is a droplet. It's spread by droplets. But when you speak, when you cough, when you sneeze, that's how it's spread. And we also think it spreads by shredding. You shred the virus from your cells, some of the virus particles. So in that, where they are going to have that quarantine type of facility, we think that if they keep on following WHO guidelines, it should be fairly safe. But again, they need to follow it very, very strictly. But are we geared for the ordinary person out here? No.
But let's hope it doesn't get to that point. One of the things is that we don't know how long the incubation period is. So people could be wandering around South Africa. Let's say the incubation period is something crazy, like a month. Surely we wouldn't have any way of knowing that, would we?
We know the incubation period. It's been worked out.
Definitely.
incubation period is anything from 1 day to 14 days with an average of 5 days. Am I right?
No, that's correct. I think we know that the incubation period is between 2 and 14 days. There are the odd outlier where the incubation period is longer, but that is not the rule. So, we're working on 14 days, and the vast majority of infections will have an incubation period in that range.
What should we look out for? It is more severe than flu, but what are the warning signs that you should get to a hospital and get checked?
Look, I think we must follow the case definition very closely because, we shouldn't get panicked, and anybody who's travelled anywhere now think, and they develop maybe a bit of itchiness in the eyes, shouldn't think that they've got the COVID disease now.
Right.
So there are specific clinical criteria that we should follow, and then there are specific epidemiological criteria which...
So give us the top 3 things we should be looking out for.
Okay, so the symptoms that are associated with disease is firstly a cough or a dry cough, shortness of breath, sore throat and fever. So those 4 symptoms are the main symptoms associated with this condition. That sounds very broad.
I was going to say you're going to have people flocking in saying, test me for the coronavirus.
Of course. But it must be associated with epidemiological criteria as well. And those epidemiological criteria rules out
Give me an
lots
example
of
one of those.
So the epidemiological criteria is the person must have traveled to an area where there is ongoing community spread of the disease. And community spread means it's spreading from people to people. It's not just like isolated cases. So we know there's only a few countries. It's China, Hong Kong, Thailand.
So that really is the big determining factor here. Okay. Well, thank you both very much for coming in. I do appreciate it, Prof. Doc. Thank you.